Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then on histology, if you do sorry, okay. Now, now role of one method which is called as intraoperative single shot intravenous pyelography in renal trauma. So, what is the role of intraoperative single shot intravenous pyelography in renal trauma? Normally, nowadays we use contrast enhanced CT scan for assessing renal trauma. But previously, this intraoperative single shot intravenous pyelogram used to be used. So right now the indications are uncommon. There is only one indication for single shot intravenous pyelogram, that is when a surgeon thinks that or sees or encounters an unexpected retroperitoneal trauma. So whenever a surgeon encounters or sees a retroperitoneal hematoma during his exploration, that is the surgeon is doing the surgery for renal trauma, and suddenly when he opens the abdominal area with the kidney, he will see there is a big retroperitoneal hematoma. He's not expecting it, but now in order to during that time when he encounters this retroperitoneal hematoma, then we do intravenous pyelogram. So what is the use of this? The aim of this intravenous pyelogram, one shot intravenous pyelogram, is to see that the contralateral kidney is normal. One, you should make sure that the contralateral kidney should be normal, and you should complete the staging of the injured site. So in IVP, if they were not normal or not near normal, then kidney is explored to complete the staging of the injury, and if there is any abnormality which is found during the exploration, that should be reconstructed and resolved.
thank you and thank you for watching.